Welcome to Outside the Box, a short conversation about how food service is changing at scale, what operators are facing, what systems are under pressure, and what becomes essential as expectations rise. Today, we're talking about what happens when a hospital food service director decides to do something nobody in Ohio has done before and runs the math to prove that it was the right call. Jeff Delahunt has spent over 23 years in food service at Dayton Children's Hospital and 15 years in restaurant hospitality and management before that. He recently oversaw the food service design for the hospital's new 48-bed behavioral health center and built the whole operation with automated locker pickup directly in the midst, something he first talked to us about during a coffee talk with the American Association for Healthcare Food Service. Jeff, thanks for being here and chatting with me again about all the great things that you've done at Dayton Children's.
Thank you for having me, Ashley.
So you've spent a lot of time in restaurants and hospitality, and you've been at Dayton Children's for 23 years. Like, what's made that the place that you've stayed for so long?
A couple of reasons. One is connection with patients and family, especially in a pediatric environment. Restaurants were great, but this is different. Restaurants serving the guest, but mainly it was really about a bottom line. And here it's about so much more than a bottom line. You get to see the kids, you get to see the amazing outcomes, and then you get to be with the team when the outcomes aren't quite so amazing.
Sure. That's amazing.
I've been given the opportunity for constant growth. I came here as the director of dietetics and nutrition. I've since added clinical nutrition, lactation, environmental services. In restaurants, I felt valuable.
Mm-hmm.
I felt valued, and it's a real difference.
No, I understand that. So talking about this, all the things that you have, responsibility over, and then building a new facility, what operational problems were you trying to solve on the food service side as you were looking at, this new building?
A couple of things. Number one, we knew our current hospital has 186 beds. This was going to be a 48-bed mental health facility. So it was going to be a much smaller operation.
Right.
Number two, it is a secure facility. Yeah. So families coming in will visit, but they come in during set times. They're escorted to their child's room, and then they're escorted back out. So there is, less than 1% need for food service for families, guests, and people from the outside.
Sure.
Looking at it in that way, and given the constant wage growth, a cashier for me is about $26 an hour fully loaded.
Okay.
And I just wasn't going to need that role. So by using automated ordering either on your laptop, desktop, or on your phone, and touchless pickup, I was able to save that position, which was a significant savings. And we are an urban hospital. We try to keep our prices artificially low, and this just helped.
Yeah, no, that's great. So tell me about how that operation's been going so far. Once that mobile ordering, and the automated pickup were in place, how was the adoption and how did it go?
It's going very well. We aren't at full capacity. We intentionally had a 2-year ramp up period to get to full census. This was something very different. We had a mental health unit, but it was inside of the major hospital. Mm-hmm. Now we're out on our own, and we knew there were going to be things we needed to learn. So adoption by the staff has been seamless.
Great.
Transaction processing has been very easy. They love it, and it's quick and it's easy. And, sometimes you have that team member who's really great at preparing food, making sandwiches, but may not always have that cheery, upbeat face that you're really looking for at the point of contact.
Sure.
That's not a concern anymore. In today's limited labor environment, it's important to be able to bring people in from everywhere and find a place where they can be useful.
Well, it brings a lot of, kind of joy and job satisfaction for those workers on your food service side too, because they're not having to do those things that they're uncomfortable with.
Yeah, everyone has a bad morning. And you can show up and kind of just go into your shell and not have to be outgoing and not have to be happy maybe on a day when you're not.
Right. No, that makes a lot of sense. And so you talked about this, savings on the cashier. Has that resulted in that thing that you kind of planned for at the beginning?
Absolutely. We had no choice. There is no point of sale system terminal. There's no person to run it. They weren't in the budget. So going backwards wasn't an option, but it was really a seamless adoption. It has caused no problems whatsoever.
No, that's great. So why did you choose to do this, kind of mobile order and pick up at the smaller hospital first versus trying it at the larger hospital?
We have a substation, and we get really busy. So 45% of our business comes between 11:45 and 1:15.
Yep.
So we would just get overwhelmed with the number of people trying to put in remote orders. And I just didn't feel we were ready yet. We're going to need to make some changes to the physical facility. That area is 9 years old. It's due for a refresh in 2 years.
Yeah.
And we won't go to solely food lockers, but we will bring in food lockers as an option at that point.
Sure. That makes sense. When you think about, have you opened that option on the behavioral health side for some of those families that are visiting, or is it mainly focused on the staff?
It's primarily focused on the staff. As I said, they have a set visitation time.
Yeah.
So because they're in group therapy most of the day, so it's not like they're sitting in a normal children's hospital where they're just sitting in a bed.
Sure.
So it really is important to keep that structured. The families are coming in, and it's not after work hours. So a lot of times families and parents are making time out of their work schedule to come in.
Yeah. So looking at then this, focus on the staff, like did that change at all how you're planning for this piece of it, like hours or menu options or things like that? And how did you handle that adoption with the employees?
The menu options are different, but that's not based on the food lockers or the remote ordering. It's just based on the sheer number of people in the building.
Okay.
In a lot of ways, in my world, it's easier to serve 800 people than it is 80 people. And the big thing for us is, you walk up to that sandwich line, and a lot of people don't make their decisions beforehand. So they're contemplating American versus pepper jack, and do I want tomato today or not? And that ordering process slows down that entire line.
Right.
Now, all the sandwich maker has to do is look at the piece of paper and make what's there. He doesn't have to help guide that customer through the decision-making process.
And have you seen that shift of the time waiting and ordering in line to the time that the staff can actually sit and take a break? Have you seen that be beneficial for them?
It is. So this is about a 60,000 square foot facility. So it doesn't take as long to get from each unit to the food service facility.
Yeah.
But still, they place the order. They know how long it will take. They know that we keep it in that locker for 10 minutes past the ready time.
Yep.
So they can come down when they're ready. They're not worried about waiting in line. In the main hospital at noon, a lot of times it'll be a 6 or 7 minute wait to get through the sandwich line.
Right.
That's 6 or 7 minutes now that they have just to sit and relax.
That's right. No, it's a huge benefit, that you're offering for that team there to be able to take that break, that, the full amount of their break, as much as you can from that by, kind of consolidating that ordering process there and then allowing them to pick up at their leisure when they know it's ready to go, instead of again having to wait in line when the food's ready to go, to be able to grab it there.
Right. Because, as a nurse, you can't leave your station for lunch until that person comes back to you. Right.
Yeah.
And then on the other side, they can't leave until you come back. So having them meet their break time is very important. Otherwise, it just cascades for the rest of the day.
Right. Well, this has been operating for you for a little while now. Like, was there anything that surprised you that you weren't anticipating that maybe you learned from it or saw from this?
It was so easy and intuitive. It really was. So really, no. I downloaded the app and I was ordering sandwiches 3 minutes later.
Ready to go. Go. So for any, hospital food service director that may be listening, watching or planning for this, seeing challenges with labor or labor costs, that is, and just not sure where the friction is maybe in their food service operation, like what's one thing they need to figure out before they, kind of jump into some changes like this?
What problem are you trying to solve for? As I said, for me we will do about 700 transactions between 10 a.m. and 2 p.m. Right now, we're just not set up to do a food locker program for that type of volume. So,
Sure.
Do you have the volume you can use it for?
Yeah.
I'm trying to roll it out, and I have great hopes for a later evening food service, where the volumes are a little unpredictable, but there's going to be a lot of lull times. So once again, instead of having a cashier there waiting, you don't have to have that person.
And they're not, having to order from delivery services that, kind of disrupts other things and stuff like that. You're giving them options late at night too. I think it's a good benefit there as well.
To be clear, that's something that we're designing right now, and we will be rolling it out. But that's where I see this being great in a low to medium volume operation, and also later in the evening to cut down the number of people you have to try to find who will work evenings at this point.
No, that makes a lot of sense. So one last question that we've asked all of the guests on this is, what's something about your job that most people don't see?
So much of my job is about the people, and it's easy to stereotype people, and it's easy to see them from a distance and judge them, their decisions and their lifestyles. We're together for a long time now, so we get to know each other. And I think money buys options. I think our teams are no different than anybody else. We might show ourselves a little bit more openly, but it's the people.
No, that's great. And I think that's what makes everything that we do helpful, is knowing that we're helping people in any big or small way.
Yeah, absolutely.
Awesome. Well, Jeff, thank you so much for being here and sharing your experiences with us today. I think someone that's kind of thought through all of this stuff and put it into practice, something that people can really learn from.
Thank you, Ashley.
And thank you all for watching. Keep out your eye for more episodes. They're coming soon. I'm Ashley McNamara. Thanks. Have a good day.